As we conduct our community-led outreach in the key population programs, we need to continuously assess if we are leaving a site or specific key populations within those sites behind. That's why the last tools in the microplanning bag is gap analysis, reviewing peer performance for collective improvement. The last two tools used in microplanning are A. Outreach summary tool, and B. Opportunity gap analysis. The Outreach Summary tool helps the outreach worker to consolidate the performance of the peer educators who they support. This consolidation takes place on a monthly basis. This consolidation through the Summary tool helps in also conducting opportunity gap analysis for each peer educator. The analysis assesses a peer educator's reach against the population size estimates in the specific site that the peer educator is responsible for. Assessing the number of key populations actually reached by a specific service vis-à-vis the expected number that the peer educator should have reached helps to highlight the gaps and informs the support needed to address them. Each month, the outreach workers sit with their group of 5 to 10 peer educators and conduct this gap analysis. Each peer educator reviews the past month's activities, comparing their target to their achievement, which forms the core of the analysis for their assigned key population cohort. This tool is a way to identify where performance needs improvement and to determine whether targets are realistic. Some of the activities assessed include one-to-one contact, registration, condom or needle syringe distribution, HIV testing, and clinic visits. All these activities are assessed against the targets and gaps identified. The reasons for the gaps are discussed and opportunities and solutions identified to address them. This also helps the outreach worker to identify which site and peer educators need more support and plan for support based on the gaps. This process also facilitates cross-learning among peer educators as they share reasons for gaps and recommend solutions.
Opportunity gap analysis is able to help a peer educator really to understand in terms of the number of peers within a particular hotspot that are located and how many are being reached with services. For instance, how many are being contacted, how many are being provided with preventive commodities such as condoms, how many are receiving clinical services. And based on the denominator, which is actually the estimate of that particular hotspot, then you are able to really look into the gaps at the different levels. What may prevent peer educators and outreach workers from achieving their targets based on the experience on the ground is that at times you find that there are few programs that you still see high peer educator to peer ratio. Because as a country, we have set standards in terms of how many numbers of peers that a peer educator is supposed to reach out to. And it is across all the typologies. We have a set peer ratio for female sex workers, and it goes down to even the transgender people. What we do is really to advocate with development partners in terms of the funders. So it's a lot of advocacy that is being done at donor roundtable meetings just to show them, look, these are the peer ratios that you're having within the programs. And we all understand really the importance of peer education and outreach in the programs. Could we see how we could at least give more resources to the implementing partners so that they're able to hire more peer educators? But at the same time, where there are gaps within the counties, then also the country has measures in terms of also finding other donors who could be able to complement.
How do you account for the ones left behind? You plan for them at the smallest level. Microplanning is generating and using data at the site and individual level to deliver services to populations with the greatest need. The simple tools are meant to empower the peer educators and outreach workers to collate and use this data for planning and monitoring. At every stage, from site mapping to site analysis to contact mapping, the use of contact forms all the way to peer planning and calendars, and finally gap analysis, microplanning relies on the trust and confidence that a peer educator gains within the key populations communities they work and support. Everyone involved in microplanning understands that it's a system reliant on the highest level of data safety. Key populations are criminalized in most countries, hence a microplanning approach that generates maps, data, and information should take care of people's confidentiality and safety. Microplanning functions best when integrated into larger key populations programming and becomes part of a continuum where data collected can be routinely validated and inform decision-making.
One of the highlights is how easily adaptable these tools are. These tools use more visuals, more numbers. It doesn't need any high literacy levels. Even if the context changes, these tools are very adaptable to make it context specific. So the fact that it has been implemented in multiple countries with multiple subpopulations just shows that every country, every subpopulation can adapt it.
For Malawi, this is the model that we're using. I can tell you that for Malawi, HIV prevalence amongst female sex workers is very high at 49.9%. When we started implementing this model, we were able to reach out to many targeted population groups. As a country now, we have managed to reach out to test over 90% of female sex workers. And also, we know that almost 90% of female sex workers who are living with HIV are on treatment. We managed to do that because of this model.
In India, when we did the evaluation of microplanning, what we realized is that higher number of hotspots were covered post microplanning, and higher number of populations in those hotspots were reached by peer educators post microplanning. But the other things that happened also was that the peer educators and outreach workers felt more empowered. They felt they had the capacity and tools to engage with their community and provide a more targeted and more differentiated outreach and service program for the key populations. So it increased ownership, it increased accountability of the program, but at the same time, the key populations and the sex workers and MSM and the drug users who were working with the outreach worker also felt more part of the program because they were engaged in the process of using microplanning tools.
If there are 1.4 billion people in Africa and we count ourselves responsible for the welfare of all of them, then can there be any group too small, too peripheral to program for? No, there can't.